Atit Neurology video series. Let's discuss about what is a hemorrhagic stroke, or why should that word hemorrhagic stroke not be used, in my opinion, in clinical practice. When I hear hemorrhagic stroke, I have no idea whether the person is talking about a bleed in the brain, which is an intracerebral hemorrhage, which a lot of doctors use for when they say hemorrhagic stroke, or whether they mean there is a hemorrhagic conversion in an ischemic stroke, meaning not a primary bleed in the brain or not a primary intracerebral hemorrhage, but a hemorrhagic conversion in an ischemic stroke. And these two things are treated completely differently. So when someone says hemorrhagic stroke, or when I read a report saying hemorrhagic stroke, I have to always see what they're talking about, because different doctors use that term to mean two different issues, which are really not related to each other. And there's been a lot of confusion with the use of this term hemorrhagic stroke, unfortunately. The other reason why I do not like that term is because when the patients are told that they have had a hemorrhagic stroke, instead of just saying you've had a bleed in the brain, then they do not really remember the word hemorrhagic. They only remember the word stroke, typically, most of them. And again, when they are seen in future and they say I've had a stroke, and you don't have their old records or their old films, and you do not even understand why they're not on a blood thinner, it becomes very confusing, and it just complicates the whole process. So instead of saying hemorrhagic stroke, what I like to say when I'm describing the condition is I like to say either intracerebral hemorrhage, or I like to say stroke with hemorrhagic conversion or stroke with hemorrhagic transformation. And when I'm talking to the patient, I do not tell them hemorrhagic stroke. I tell them that you've had a small bleed in the brain or a bleed in the brain, or you've had a stroke and there's a little bit of blood within the stroke. I do not use the word hemorrhagic stroke. It's caused too many problems in too many patients which I've seen over the years.